The A1CNow Plus is an important piece of our diagnostic product portfolio because of the overlapping disease state and testing in patients with metabolic syndrome and/or diabetes. An abbreviated look at metabolic syndrome defines it as a cluster of conditions: increased blood pressure, a high blood sugar level, excess body fat around the waist, abnormal levels of cholesterol, especially HDL and triglycerides. When these occur together or in combination, the risk of heart disease, stroke, and diabetes is increased. The National Institute of Health, the NIH, has published guidelines for identifying patients with metabolic syndrome. According to the NIH, the combination of any three of these criteria can identify a patient's condition as metabolic syndrome. People with an apple body shape have a higher risk of becoming insulin resistant and developing heart disease. This accounts for 34% of Americans over the age of 20. The classic definition of diabetes is general because the problem is the same whether the pathway is type 1 or type 2 diabetes: too much glucose, not enough effective insulin. One challenging goal for patients with diabetes is maintaining a good glucose level to help avoid any complications of diabetes. Many things that people without diabetes don't think about, a person with diabetes has to be aware of constantly. People with diabetes should avoid going barefoot. People with diabetes have to be prepared at all times for low or high glucose episodes. People with diabetes can't always supersize and remain healthy. A slice of pizza, a tiny dessert, or a Starbucks favorite can dramatically influence glucose levels. Glucose swings can correlate with mood swings. Glucose levels are like the stock market: constant ups and downs. A patient who is familiar with his or her glucose measurements can visit the doctor and get a really good glucose result, depending on the time of day and food consumption. Although a random glucose reading may be helpful for some, for a person with diabetes it may be timed in one of these low or high points and not represent the average blood glucose experienced throughout the day. The bottom graph line is representative of a patient without diabetes. Patient 1, or the dashed line, represents peaks and valleys of a patient with controlled diabetes. Patient 2, the top thin line, represents a patient whose diabetes is not controlled. This is where A1C, along with individual glucose, becomes vital for the monitoring and treatment of patients with diabetes. The A1C indicates an average of highs, lows, and in-betweens of blood glucose over the past approximately 120 days. Let's look more closely at A1C in monitoring a patient with diabetes. How can it know the average of circulating glucose over the past 120 days? And why 120 days? Glucose in the serum portion of blood can move freely through the cell membrane of the red blood cell. This creates an equilibrium of glucose inside the cell relative to the glucose outside of the cell. The red blood cell has hemoglobin that carries oxygen throughout the body. Glucose can permanently bind to the hemoglobin at a rate proportional to the amount of glucose in the circulation. New red cells are made every day, and the average lifespan of a red blood cell is about 120 days. HbA1c is technically called the glycosylated hemoglobin, or hemoglobin A1c test. The A1c represents the fraction of hemoglobin in the red blood cell that has been used to standardize the test for the amount of glucose bound to hemoglobin. Thus, a measurement of the percentage of the hemoglobin that has glucose bound to it provides an indication of the average amount of glucose in the blood over the last 120 days. A person without diabetes will usually have an A1C below 6%. People with diabetes should strive for an A1C below 6.5% or 7% if possible. Our CardioCheck PA and Plus analyzers are diagnostic tools to measure lipids, cholesterol, HDL, triglycerides, and current blood glucose. Together with the A1CNow Plus system, we can aid the patient and physician with a clearer picture of all the metabolic syndrome conditions. To use the A1CNow Plus test, we follow the same guidelines and regulations as other CLIA-waived point-of-care testing. We follow the manufacturer's recommendations. Two important guidelines are lot numbers must match, and run the test at room temperature. We'll cover these and more as we begin our testing. Let's start with the correct storage and handling. 3 important pieces of information. 1. Room temperature storage for up to 4 months. A1CNow Plus monitors, pouch test cartridges, and sample dilution kits may be stored at room temperature, 18 to 28 degrees centigrade, 64 to 82 degrees Fahrenheit, for up to a cumulative 4 months prior and during use. 2. Extended shelf life if refrigerated. The monitors, test cartridges, and sample dilution kits may be used until the expiration date printed on the box and on the pouches when stored refrigerated, 2 degrees to 8 degrees centigrade, or 36 to 46 degrees Fahrenheit. 3. Handling requires bringing refrigerated product to room temperature before testing and leaving the pouch components in the pouch until the moment of use. Leave all components in their sealed pouches until use. If refrigerated, ensure the pouches are at room temperature for 1 hour before use. Remember, do not mix pouches and monitors from different lots, and never use expired product. You can now see the components that we will use in testing of the A1C, although they are pouched separately and only opened at the moment we need them. We can use capillary or venous whole blood. Venous samples must be from a green top, well-mixed heparin tube. Sample size is 5 microliters. Measuring range is 4 to 13% HB, A1C, NGSP, DCCT units. Measuring time is 5 minutes after detecting sample. Place a pouch 1 and a pouch 2 along with the kit monitor in front of you. Verify the lot number on the pouch with the lot number on the back of the monitor. You will find the lot number at the bottom of the pouch. You will see it circled on your screen. We will open the pouches as we need them and in sequence. If stored in the refrigerator, the pouches and monitor must be brought to room temperature for 1 hour before testing. Open pouch 1 only and remove the blood collector and the sampler body inside. The test requires 5 microliters of either a fingerstick or venous heparin green top blood sample. Good fingerstick technique is still important, even with a small sample. Cleanse the ring or middle finger well and allow the residual alcohol to dry thoroughly. Place the lancet at a 10 o'clock or 2 o'clock position on the finger. Slightly squeeze a drop of blood and touch the end of the blood collector to the drop for an automatic fill to the end of the channel. If it appears to have too little blood, release and squeeze a second drop to complete the fill. Be sure to avoid air bubbles in the collection channel. If it appears to have too much blood on the outside of the blood collector, wipe lightly from the base to the tip, being careful to avoid touching the tip and accidentally wicking sample from the channel. With the 5 microliter blood collector completely full with no air bubbles, firmly push and twist the blood collector into the sampler body, ensuring there is no gap or space between the sampler body and the blood collector. A good shake 6 to 8 times will ensure the mixing of the sample and the reagent in the sampler body. Allow the sampler body to stand on the table while we prepare for the next step. Keeping the sampler body standing during this period allows the blood cells to break open in the solution and the glycosylated hemoglobin to mix into the solution. Now we can open pouch number 2 and remove the cartridge inside. Remember, until this point, do not open the number 2 cartridge pouch. Ensure that the important codes on the cartridge and the monitor match. Insert the cartridge until you hear it click. Watch the screen for the display to add the sample, then remove the base from the sampler body. Apply the sample to the cartridge with a quick press and release motion. When you hear the snap, it will allow the exact amount of sample to be inserted into the cartridge. At this point, we do not move the monitor. After 5 minutes have passed, the meter will display 3 messages. QC OK, indicating QC test result. A1C percent, in this case 6.7. Readable range is 4% to 13%. And number of tests left, 0, 8, TL, or 8 tests left. If QC-OK is not displayed, an error code will be displayed in its place, and no A1C result will be shown. When measured, the result will be displayed for 60 minutes, or until the next test cartridge is inserted. After the A1C result is recorded, remove the cartridge with gloved hands and dispose in a biohazard container. Note that the monitor will continue to alternately display the result as well as the number of tests still available in that monitor. The monitor is reusable until all the cartridges in that kit are depleted or the number of tests left is 0, displayed as 00TL, whichever comes first. If a cartridge is clicked in place in the monitor and then removed before the sample is applied, it will consider it a completed test and count down on the available tests left. Only use the monitor with the test supplies that came with it. Do not mix different kits. The monitor will expire after the program number of tests have been run and can be disposed of as electronic waste. Each A1CNow Plus monitor performs over 50 internal chemical and electronic quality control checks, including potential hardware and software errors, such as cartridge alignment and programming, and potential reagent strip errors, such as insufficient sample volume. The monitor has been programmed to report an error code if these quality checks are not passed. External quality control testing should be performed at the following times: with each new shipment, with each new lot, with each new operator, whenever problems such as storage, operator, instrument, or others are identified. To ensure that storage conditions have not affected the product, run a control sample before running a patient sample if the test kit has been stored for more than a month and it has been at least a month since the last control testing. The measured values should be within the acceptable limits stated on the control material. If the results obtained are outside the acceptable limit, please review the procedure and retest the control material. If the measured value continues to fall outside the acceptable limit, please refrain from analyzing additional patient samples and contact customer service. Good laboratory practices include a complete quality control program. This entails proper sample collection and handling practices, ongoing training of testing personnel, ongoing evaluation of control results, proper storage of test kits, etc. A permanent record of control results should be retained for 2 years. Thank you for attending today's training. You will see a link on the screen that will take you to a quiz and certificate for your participation. In addition, you will see both the U.S. and international phone numbers for customer service. Thank you again for your time and attention.